Today I'm going to be talking to you about proper attire of a pharmacy technician. My name is Contessa Payne, and I am a certified pharmacy technician here in Chattanooga, Tennessee. I work for one of the main hospitals inside of Chattanooga. The name of the hospital is Attire Hospital. The hospital that I work for is downtown, which is also the main campus inside of Chattanooga. I'm going to talk to you today about a few key points about things you should and should not wear in the pharmacy. The first main key point is, like I said, what you should wear inside of the pharmacy. The second key point is what you should not wear inside of a pharmacy. And the third key point I'm going to talk to you about is aseptic techniques. Along aseptic techniques, I'm also going to dress down and show you a demonstration of things you have to wear when you're not inside of the pharmacy or outside of the pharmacy on the floor dealing with patients or interacting with nurses or other staff members. Floor work attire. It is very important as a pharmacy technician that you have good, supportive walking/running shoes. As a pharmacy technician, you have really hectic days. You have a patient that's down ER that has a cardiac arrest, you have to run a stack IV down to ER. You have a patient on the night floor that needs a stack IV drip. You never know. So as a pharmacy technician, you should always come well prepared to work, ready for the day. If you do not have proper shoes, you are so going to regret it. You're going to have sharp back pains, and your knees might even hurt as well as your feet. As a technician, there's something that you cannot afford to risk, because no matter how bad you're in pain, you still have to get the job done. To the right side, I have a picture of scrubs. It is mandatory at the Attire Hospital that each department wears different color-coded scrubs. Today, I'm wearing my gray work scrubs with my ID badge. Inside of the pharmacy in the Attire, we have to wear gray. All technicians do as well as pharmacists. If you work up front inside the Attire Hospital, you are allowed to wear khaki pants and polo-style shirts. The reason why, because you're only answering the phone and you'll feel the sip of meds through the IV tubes as doctors, nurses call for them. When you're up front, you're not running on the floors delivering things. You're just standing up front and doing what you need to do for pharmacists as well as doctors and nurses. The third most important part in the pharmacy, maybe the major most important part, is the IV room. The IV room has really strict protocols. You are not allowed to wear your work scrubs inside of the IV room. So if you come to work and you're scheduled that day to work in the IV room, you must dress out and change into Attire pastel blue surgery scrubs. The reason why you change into the scrubs is to keep them from contamination from crossing from your street clothes into the IV room. Inside the IV room, you must also wear a blue heated neck cap, a face mask, gloves, booties, and sometimes a jacket shield as well. It is very important you wear these things because you're making IVs for patients. And the last thing you want to do is contaminate an IV and make a patient sick. So I'm going to demonstrate to you right now how I would get dressed when I'm getting ready to work in the IV room. First, I will walk in. I can't bring the blue scrubs home. It's against the Attire policy. So I can't put them over these scrubs. But if I was coming into work, I would go straight to the ladies' restroom. I would take off my scrubs, my ID badge, my pants, my shoes, everything. Put on the blue scrubs. Once I put on the blue scrubs, I would go inside of the IV room, in the back of the IV room, not the part where you make IVs yet. The first thing I would do is put on my hat shield. They give you these thin little hair bunny nets. Like they wear these in surgery as well at the hospital that you put on so your hair will not contaminate anything inside of the IV room. You make sure that all your hair is inside the hairnet smoothly. Nothing is out or anything like that. The next thing I usually put on after I put on my blue scrubs and my head bunny are my shoe booties. Here are my shoe booties. These are mandatory when you're in the back of the IV room. You cannot put these on in the restroom because you will contaminate them. These must be put on back inside of the IV room only. So I slip those on right quick. That's my left foot. And now I will slip it on to my right foot as well. After I have put on my hairnet and my hair booties, I will put on my blue lab jacket for the IV room. This is also very important. The blue lab jackets come in something like this in the stirred package as well. Once you take them out the paper wrap, you have to unwrap it with this blue layer paper as well. This goes in the garbage. You open it again. As you can see, it's like a long lab coat. I have to take this off the back of the lab coat, the cardboard. This goes in the garbage can as well. I put it on one arm by one. Once my lab coat is placed on, I have to tie it from inside out. I have one tie on the outside, another tie on the inside. I will tie this one first. Then after I tie that, I will go on to tie my outside one to this one. And I have one in the back, this one. And make sure that these are tied as tight as they can be. The next thing I'll put on for the IV room before I go back in to make IVs, I will put on my face mask. Here's the face mask that we have to use for the IV room at Airline Hospital. I'm sure other hospitals have to use them as well. And I will just tie this around my mouth. Before I put it in my mouth, you will understand what I'm saying. Once I put on this around my mouth, I have to put on my gloves. But the most important thing, before your gloves go on, you have to wash your hands. So I put on my face mask. Tie this, and I'll tie the other one around as well. Now my face mask is on my face. The next thing I must do is wash my hands. Once my hands are washed and sterile, I will then put on my sterile gloves for the IV room. It is important that your gloves are placed over this part of your jacket. So I put on my first glove. And once I get this one on, I put on my second glove. Now I am ready to go work inside the hospital as a pharmacy technician, getting ready to prepare IVs for the day. Next, I'm going to talk to you about things you should not wear inside the pharmacy. The question I have on here is what's wrong with this picture. The technicians get ready to work inside the IV hood, but something is wrong. She has on earrings. I'm not sure if you can see from this picture, but you are not allowed to wear any jewelry inside the IV room because it can contaminate anything that you're making. Nextly, talk about things that cannot be worn inside the IV room. Fingernail polish cannot be worn inside the IV room. Makeup cannot be worn inside the IV room. Wristbands, jewelries cannot be worn inside the IV room. The only thing that can be worn inside the IV room is your wedding band. But you have to double glove if you have on your wedding band as well. Things that can be worn on the floor. On the floor of the hospital, you are allowed to wear makeup, but keep it professional. Earrings, but they also must be professional. 1 set of rings, 1 necklace as well. The rule is not as strict when you're outside the pharmacy, since you're not making things, you're not going to contaminate a patient. But at the same time, you don't want to get makeup over any drugs or anything by mistake. Lastly, as a pharmacy technician, proper attire is always required to be worn on the floor and inside the IV room. Proper attire should also be worn inside the pharmacy as well for professionalism. Here's my presentation on proper attire for a pharmacy technician.